Hi, I'm Dr. Rasya Dixit. I'm a dermatologist in private practice in Bangalore. I have been practicing from the last 18 years. We are living in an age of fear. We are afraid of eating gluten, afraid of wearing parabens, we are afraid of eating dairy. It is very important for us to understand how much of the effect that these agents actually have on the skin. Gluten hypersensitivity is known as celiac disease, which is a gut sensitivity to gluten-containing foods. Gluten-containing foods are very common. They are basically present in our wheat. So all our breads, rotis, chapatis could be containing, even our maidas could contain gluten. So when we talk about gluten hypersensitivity in the skin, it is known as dermatitis herpetiformis, which causes a rash usually in the buttock area, which is a very itchy rash in the buttock area. Gluten hypersensitivity has also been linked to inflammatory skin conditions such as acne, such as psoriasis and other autoimmune skin disease. However, it is not very sure, we are not very 100% sure that if you have any of these conditions like acne or psoriasis, you should completely avoid gluten or not. Because the evidence shows that unless you have celiac disease, which is the inflammatory gut syndrome, you do not have to avoid gluten for these skin conditions. So if you feel that you have a gluten sensitivity when you eat wheat-based product, you are experiencing bloating, pain, gas, then speak to your dermatologist, speak to your gastroenterologist, get diagnosed, understand that you have an issue with gluten and then start cutting it out of your diet. There is no need to cut it out of your diet if you just have acne or psoriasis, which is not associated with anything underlying with like a celiac disease. So instead of making a self-diagnosis and instead of starting to cut down foods in your diet, which could lead to dietary insufficiencies, it is better to always speak to your doctor and understand the implications of being gluten sensitive before you decide to do so.